Hey guys, it's Dr. Day, and we're here at Mountain Movement Center in Greenville, South Carolina, the center I created to inspire people, to help people heal. And if you have a health issue that you've dealt with for a long time, weight gain that you just can't, you've tried everything, or you feel just kind of blah all the time, this video, I believe, is for you. So I hope you stay tuned. I have worked with over 40,000 patients through 12 years in practice, working on nutrition, functional medicine, and mind-body medicine, and musculoskeletal issues. And another thing I created was the restoration plan. And in the restoration plan, we've led over 1,000 people through the principles that I created after dealing with chronic health issues for years and years. And the number one thing that the restoration plan tries to help people see is that their health is not in a fixed state, that we want them to go deeper into their health. Oftentimes they get labeled with a diagnosis where they are told they are genetically susceptible to this thing, and they feel like the jail cell doors have closed and that's their identity there forward. But now we know that their body is changeable, interconnected, and there are all these systems working towards healing. Your body's going to change over, your cells are going to change over, and with some faith and the right information, you can heal. And so that's why I'm here today, to start on a series to inspire encouragement, to bring encouragement, to inspire and bring hope to you. And what we want to talk to you about today is a concept called the gut-brain axis. And so what we're seeing in the research is that the brain communicates to your digestive system. So your stomach, small intestine, large intestine, and colon, they don't just kind of connect, they literally crosstalk. It's a two-way street. And so we're seeing people with brain injuries or intense amounts of stress, like a concussion or PTSD, have massive changes to their digestive system. And then we're seeing people with chronic digestive issues deal with mental, emotional stress, anxiety, and depression. And this has implications beyond that. The gut-brain axis is implicated in weight loss, in fatigue, in chronic pain. When your digestive system's off, they're seeing that people have something called hyperalgesia, which means they feel more pain all the time. So that has implications for chronic fatigue and fibromyalgia. And chronic fatigue is what I went through for years. And learning about the gut-brain axis gave me hope. I could see that there was this vast miracle that my body was created for. And then I started to see that God had a deeper plan for my healing. So let me show you a visual of the gut-brain axis. And so we have these nerve connections that feed through our nervous system, down our spinal cord, and out and interweb with our entire digestive system. And these connections are called the enteric nervous system here, and then this is your central nervous system, your brain. And so you can imagine that if we're eating a diet that's very inflamed, if we're eating a lot of sugar, that's going to send messages up to the brain. They're even showing that the number one happy hormone, serotonin, is actually made in the gut and transits to the brain. We all know that there's a deeper connection here, and even a spiritual connection, because we can feel when we have a gut reaction to something, right? So I believe there's so much interconnection between our spiritual walk, our physical health issue, and that you are not in a fixed state, but you're in a malleable state. And we want to go over the simple changes from the restoration plan you can do to fix this. So one of the concepts in the restoration plan is Tiger, Hammock. Tiger represents the sympathetic nervous system. Hammock, the parasympathetic nervous system. So if you were watching this YouTube video and a tiger jumped in the window, you have to imagine the way your brain and spinal cord and your nervous system would react is to either fight or flight, get out of there. And your way your nervous system would signal would be increased heart rate, increased strength to the muscles, more blood flow to the muscles. Cortisol would emit from here, your main stress hormone, and epinephrine. There's a lot of other effects that would happen. But as it pertains to the gut-brain axis, this fight or flight, when done in excess, we have found it affects that enteric nervous system that we talked about, and it decreases motility, which means your gut, the natural movement of your digestive system to digest food is going to come to a halt or slow. And the secretions that digest and break down your food so you can get all the nutrients from them is also going to slow, especially with chronic stress states or one major stressful event. But that's not fixed. We can actually fix that, and we're going to talk about that next. We also see in the GutBrain Axis research that with chronic stress, you're going to have increased permeability. So you have these little tight junctions between the cells with kind of gateways, and with chronic stress, those gateways open and food particles can go across into the bloodstream, creating immune changes like food allergies, food sensitivities, and inflammation. As well, we're going to see just an overall decrease in assimilation, which links with the ability to take in nutrients. So we'll see people with mineral deficiencies and magnesium deficiencies and all these things. And that has long-term effects on the gut-brain axis. And lastly, we're going to see decrease in the microbiome. Fancy word for good bacteria in all the different classes. So your gut looks like a forest with different phylum and classes, and the diversity is where the health is, and the diversity signals for serotonin to be made, and GABA, and different things that are your relaxation neurotransmitters. So when we get cortisol blasting off for too long in this tiger mode, we're going to see these changes. Now on the hammock side, the rest and digest, this is where we want to cultivate. And just like I talked about the microbiome being a force, we want to cultivate little mini breaks in your day. In school we learned it was called rest and digest, okay? So this is when we're chilling, relaxing, and healing. So increased healing, you have to have time for your body to heal, your cells to heal, your brain to heal with adequate sleep, rest, mini breaks, brain breaks. Increased digestion, which means increased motility. When you have time to digest, you can assimilate the nutrients. You have a fortress of a digestive system with an immune system that's going to work for you, not against you. And the motility means you're going to have normal bowel movements and you're going to feel good. When you're not having good bowel movements, tell me one person that feels good during that time. So understanding the tiger hammock system and the duality of it, that there is two sides to your nervous system. And we used to think we had no control over it. But now, lifestyle, look, kind of messy, lifestyle and awareness and our spiritual life and our time in reflection and our time in quiet and doing things creatively and things we love. So how do we get into hammock mode easily? And that's something we talk about, is cultivating hammock moments. We often think of health as I just need this one pill, this one answer, this one breakthrough, and I'm going to be healthy there forward. But we actually see that health is like cultivating a garden where you're working through your lifestyle and making small changes that are going to create whole new pathways of health and vitality. And they often run right alongside your life's purpose. So if we can kind of see our dreams and our purpose, we're more likely to make the small changes throughout our day. And if we can bring awareness back in and go, man, I'm interconnected. My brain actually has a plasticity to it. My gut-brain axis can change and it talks all the time. So what I'm doing now has significance. That's the number one thing I've seen in 12 years is people think that they are fixed and there's no significance to the day-to-day, that it's just what it is. And I want to show you quick, easy ways that that can be changed. So number one, I have found that just taking quiet time is a very lost art in our modern society. Slowing down. And one of the ways we found the easiest way to slow down is 5 minutes before a meal, that you just stop and you go through a 10, 20, gratitude list. You don't have to save it for Thanksgiving. We just went through Thanksgiving. It could be a daily thing. You stop, you take some deep breaths, you think about the food, where it came from, you think about that we're blessed to even have food, and you slow down and you say grace. The pace of life is number 2. To cultivate hammock moments, you have to be thinking, maybe sitting at the computer for 2 hours at my job isn't conducive to hammock moments. So I just work on 2-minute micro breaks on the half hour, and if you're really having a hard time, on the hour. And be creative with them. I highly doubt your boss is going to mind if you go take a walk and back, or you take 10 deep breaths. One of the keys that we're seeing is we don't get enough outdoor light. So get outside for 2 minutes, or make sure to get outside on your lunch. Movement of any sort turns on hammock moments, especially if you link up breathing with it. And this isn't just conceptual things that I'm just making up. We're now studying things like heart rate variability and neural connections and neuroplasticity, that movement actually turns on something called proprioception. And when proprioception's on, it turns off another signal, which is nociception. Nociception are pain signals coming. So there's an information superhighway coming from your muscles, your breath, you're receiving all these signals. And in Restoration Plan, we want people to be more creative. Number 3 is sugar is a tiger. Sugar acts exactly like a stressor from the outside. It ramps up inflammation in our bodies. It makes our insulin work harder to manage that excess fuel. It has a lot of effects that look like a tiger to our brain. So yes, we get to have our treats sometimes, but when we understand that our food has more ramifications to our life's purpose and to where we want to go, we're more likely to make the small changes. Eating more fermented foods. We have eaten fermented foods for thousands of years, and we've just stopped. And so incorporating kimchi and sauerkraut and pickles and kombucha and yogurts. Now if you can't do dairy, in some parts of the Restoration Plan we don't do dairy, or you're sensitive to kombucha, there's 1,000 other ways. And in another video we'll go over supplements and what supplements can help to balance the gut-brain axis. Number 1 thing I want you to think about is your body. There's no one answer a lot of times. There's interworking things. You have toxin overload, which is slowing down and changing the way your immune system communicates. You have chronic stress over here. You have some dysbiosis in your gut. You're not eating enough pre and probiotics. All these things are interweaving. And if we just start making the small changes, it's almost like the door opens up and we can make more changes. And that's the thing I wanted to encourage you about. And I want to lead you through one quick exercise that has helped me slow down in life, because I tend to be a bit of a type A person. And all you have to do, you're moving fast in life, is you put your hand on your belly and you put your hand on your heart and you focus on long exhales throughout your day. And you just slow it down for a second. And you cultivate and think what, not just that you're doing it, but what's happening physiologically in your brain and your digestive system, because it's not fixed. One break could be the beginning of your health future. So we're going to go here and here. We're going to take a deep breath and we're going to focus on an exhale with pursed lips, like this, like you're breathing through a straw. And what you're going to find is you actually have the awareness to relax the muscles and all the tension around your gut and stomach. You have the ability to get your diaphragm moving, and you can even I've worked with heart rate variability, but you can actually feel the beat of your heart and slow things down. And when people get hooked up to heart rate variability monitors and begin to work on their breathing and on quieting down and some source of prayer or meditation, their heart rate variability changes for the better. So take that micro break. In the show notes below, we'll have links to articles about all these topics. If you're interested in becoming a patient, there's another link to our center, Mountain Movement Center in Greenville, South Carolina. If you're interested in the restoration plan, there's going to be a link below for that. And look for more videos that are going to interconnect to this video. Hey guys, if you have had health issues that were changed by fixing your digestion or working on your stress, and you have a solution that you didn't see in the video, share your go-to thing that changed your life below. Sadly, we can't answer health information in the comments below, but if you just want to share what you're going through so that other people can kind of read it and think about you and pray for you, feel free to do that. And lastly, hit the like button because we have a lot more coming. So please subscribe, and we would love to hear from you on topics that you want to see in the future. And again, this is Dr. Day in Greenville, South Carolina at Mountain Movement Center. I hope you enjoyed it.